Oh,
I think we're live. Welcome to Total Health Talk.
we are live. Welcome. Hello.
This is what happens when you have a conversation. You suddenly go live in the middle of your conversation.
Yeah, and the to be continued.
Now my light is on my microphone.
Oh, that's better. That's fine.
Tasty. So tasty. Hey, I'm Dr. Christopher Vogelmann, chiropractor to all politicians in DC. And with me, as always, is Monika Klein, whom I call the nutritionist to the stars, because she's a star.
I'm a star. You know, I did this test called the Health Dynamics Test, and I actually came out a star.
Well, there you go.
Yeah, there you go.
Truth
So,
in advertising.
but it's also an Ayurvedic test, so you find out your dosha, and it relates to how you go through life. It's really quite an interesting and a very in-depth look at who you are, which I'm all for.
Who am I? Why am I here? Hey, so if you do that Ayurvedic thing and you have too many medications, do you overdose? No. Oh, well.
How long did you just think of that, or have you been thinking?
Just now, it just came to me. I have not been saving that one.
Looking at contraindications, there was a medication that one of my husband's doctors prescribed yesterday, and I looked at it and I realized that there is a contraindication. So this is really important. You really need to research any prescription. Don't always rely on your pharmacist to catch this, but always research, especially side effects and interactions.
Yeah, interactions.
You don't want to. You want to make sure that what you're taking, if you are in fact taking medication, that doesn't conflict with something else you're taking. So anyway, it may be fine, but you need to catch it. And I really am I love to empower patients and people who are taking their health into their own hands. So, this is one tip to really, really help you take your health into your own hands.
I will tell you that I've had some experience where the pharmacist catches things far more efficiently than the nurses or the doctors. Depends on your pharmacist. So
and also it's a good idea to give updated medication lists to your physicians, because that helps too. And sometimes, in the case of my husband, sometimes it's in flux, but oftentimes it's very stable. But every once in a while, a new one is added or taken out. So keep them apprised.
The one thing that's really funny, though, too, I've been to some medical doctors who don't delete the past medications that you might have been taking. And it seems like you, as a patient, have to come in there, or as an advocate for your loved one, go in there and correct the records. So you have to be vigilant about that.
All the time in the hospital. I mean, he's been going to his hospital for years, and I'm always having to, like, there's medications he took like 10 years ago, and it's still on the list. So you have to be on top of it. No matter, I mean, my husband was in hospitalized 10 times last year, and every time I had to do this, and it's infuriating, but it's necessary.
You didn't get a discount if it was a dozen?
No discount. He got 4 weeks, 4 months stay in a SNF. So maybe that's not even a discount. That's
it's worth extra points.
Opposite of discount.
Big discount. Discounts.
It's the opposite of discount.
It's true. Hey, we can't discount the number of COVID cases that are surging in this country right now.
Yeah,
it is surging. So you're up in LA area, and I'm down here in San Diego. We're moving from our whatever caution thing it was to purple now. Purple people.
I haven't been paying attention to the color coding, but I'm actually on the verge of Ventura County. So I'm still part of LA County, but I'm almost in Ventura County. So both counties impact us. So that is happening. And I was, just talking to my brother in my hometown of Winnipeg, Canada, and they're in the red color. Is it a code or is it a flag?
It's a color. It's a color code having to do with, it depends. I think the scale is probably the same in Canada as in the US. It's the percentage of, you're looking at the 7-day moving average, and it's the percentage of new cases.
Right.
So
So I cannot believe it because they had very low rates, very low rates. And of course, it's usually in the nursing homes they're seeing it now. But
not anymore. Now it's because of family gatherings primarily.
well, no, in this particular
Oh,
situation,
in
my
that case,
hometown, it's due to that specific, but also that too. Gatherings, restaurant, laxity.
by the way, game nights are actually a source of surge. People getting together to play games.
You can do that online. I was just watching
Yeah.
this Netflix limited series last week called The Queen's Gambit, and it's about chess playing, this
Mhm.
female who becomes a phenomenon. So I was trying to look at, chess because I learned how to play chess, what my father taught me. And, it's hard to find chess players. And so I was looking online, trying to find some apps. And so if anyone knows of any good chess apps,
Do you want to do three-dimensional chess? That's
yeah,
really
yeah.
hard. Have you done that with multiple layers? You've got like
No,
three boards. You have three simultaneous boards. I've never done that, but I've always wanted to do that.
well, that's what she was doing. She was playing like 10, 12 people at a
Yeah.
time,
Yeah.
so no, I'm not interested in that.
Okay. But there is
Maybe when I get into it, maybe I would.
yeah,
Maybe one game would be too boring.
my wife Maggie's family, they're all big time chess players, like I mean, huge competitions with chess. And we played a lot of chess when I was a kid in Buffalo, but in fact, I even built a special chess bench to
Yeah,
hold the table and all the
we
pieces
had
and
that
everything.
too. We had that too.
Yeah, my shop teacher was really kind to me. He let me use a whole bunch of mahogany that was supplied to the school, and I didn't have to pay for it, which was amazing.
Yeah, it's a great game.
Yeah,
it really is.
So back to the
Back
things
things
that you can do. Red alert.
Yes, red alert.
See, we're purple and you're red alert. So our
No,
rate,
no. I'm not talking about LA. Is LA?
you're talking about up in Winnipeg.
Yeah, I'm talking about Winnipeg.
Okay.
And, yeah. And also this is an interesting thing. They do not need to wear masks outside.
No.
And so I was trying to figure out what is it, because I'm doing daily walks now, and this is where I live is a fantastic walking area. Everyone loves to walk here. So I'm constantly dodging. I've got my mask, and it's so I think I shared this last week, but what is the status on that? Mask outside? No masks outside.
Well, it depends on your jurisdiction. Masks outside here in San Diego County. Or some people would argue it's masks in public places, but if you're on the street and you're in an area that's public property, we've locked down all of the stores now. The stores can only be operating at 25% capacity. There's no indoor dining any longer. There is only outdoor dining, and all the bars are closed.
Yeah, and that's okay, outdoor dining here, and although it was pretty cold last week, but every other part of the world, the country and the world, northern hemisphere, is going to be pretty cold to be dining outside. So
it's surging, yeah, and so even in Manhattan, although it tends to be fairly temperate compared to, say, Green Bay, Wisconsin, or Winnipeg, it's very difficult to operate with outdoor dining unless they have these plastic bubbles, and you could theoretically have a heater near the plastic bubble, but the danger is that the plastic bubble could catch on fire. And so it's really hard to do outdoor dining in most of the northern hemisphere.
Well, I guess you could have heaters. I know.
That's my point. Like, you could do little space heaters and things like that. But those
they
propane
have
heaters?
The big heaters. They have the big heaters in restaurants here. In Southern California, they have them in every restaurant because people love to dine outside here. Two of my nursing students are graduating tomorrow, and they're having a big ceremony outside at a golf club and a country club. And so they're going to have space heaters. And
I hope they don't get stuck in the sand trap.
No, I don't think they're eating in the sand trap.
Oh, okay.
Or receiving their award, but it's a country club. It's a country club. Let me rephrase that. I mean, it's also a golf course, but
yeah.
But yes, so yes, there are trials and tribulations about everything.
Well, I think I do believe, and I've said this many, many times, and I think you've said the same sort of thing. If we just had 4 to 6 weeks or 4 to 8 weeks of everybody just practicing social distancing and wearing masks and all, this thing would be greatly reduced. I mean, to the point where it would be relatively insignificant.
Well, I
But
was
I think it's our rugged individualism and people all worried about, I mean, believing weird things like masks will cause you to die. If that was the case, every nurse and doctor should be dead in this country, and it's do-it-yourself healthcare in the hospital.
well, I was just listening to John Campbell again. I haven't listened to him for a while, but I was listening to his YouTube channel again, and he was talking about some studies, some research that has been done in Thailand, where someone was actually had symptoms. She was a hairdresser, but she wore a mask, and her clients wore a mask, and no one got infected.
Yeah, it turns out there's some recent studies that actually point to the fact that we always thought about masks as being a way for you not to spread the infections if you didn't have the N95 masks, but it now turns out that some recent studies show you also reduce your risk of catching it if you wear a cloth mask, which is quite remarkable. And those gaiters are not as efficient as a cloth.
You mean those shields?
No, gaiters, the ones that they're like a neck gaiter that comes up and does this. The porosity is so great.
I
mean,
don't
stuff
know
can go in
those.
there.
I must know what those are.
They're gaiter. You'll see them. People have them around their neck, and it comes all the way up like this, and it goes down the neck. It surrounds them. It's like living in a tube.
Yeah,
but the material.
I mean, I have a little bit of an issue with claustrophobia. So, I mean, anything like that, just sort of not.
Well, it's just, I mean, it's mostly around the neck so that you can pull it down and put it up very easily without having your ears, involved. Whoa! I almost dropped my water with my elbow.
Your ear demo.
Mm-hmm.
Yeah. So, it's it's just quite what they're doing in Australia. They're actually allowed to visit New Zealand, but I don't think New Zealand's going into Australia at this point. So that's
I would think that New Zealand would. I would think that New Zealanders would quarantine the Aussies when they came over.
Yeah, well, or was it the other way around?
I think it's the other way around. You can go to Australia from New Zealand because they're amazing at this thing.
Well, it's like Canada. You can come in for Canadians. Yeah, I'm sorry, I must have gotten that wrong. Canadians can come into the U.S. and then go back, but U.S. can't go into Canada. So
it was so strange. My sister was going to come here for my wife's birthday, and she decided not to because what happened was New York State had lower rates and California was peaking. And so if she'd come to California, she'd have to and went back to New York, she'd have to quarantine in New York for 14 days. Couldn't get out of the house or do anything. So but it was just the opposite in the spring.
Don't you need to quarantine if you're traveling?
Well, now you do, but most people ignore it. I mean, I've had some relatives who clearly were ignoring it. They weren't. Yeah. They were on a 1 week or 10-day trip. They weren't quarantining for 14 days on a 1 week trip.
Yeah, I had a dear friend. She went to visit her daughter across country in Canada, and they both had to quarantine for 14 days. Mm-hmm. So, yeah.
Quarantine ain't very keen. Hey, speaking of keen things, can we move on to our Q&As?
Let's do it. Let's COVID for Q&A.
From COVID to Q&A, we put the Q, not the QAnon. Peggy, hello. Must be Margaret. Peggy from Ventura asks, I started a healthy eating program, and now I'm having a hard time sticking with it. You got to stick to it to do it.
Yeah, it's always tough. What I find, what happens is you start feeling like you have made some accomplishment, or maybe you haven't.
You're going to reward yourself with a piece of cake.
Yeah, and here's the thing too: you want to not be weighing yourself on every day.
Make you crazy.
Once every 2 weeks, because that scale can be not a very good thing, and it will rule your life. And if you've been so clean and good with your food, and then you hop on and you see nothing change, well, that's going to depress you. That's going to demoralize you and maybe make you feel like it's not worth it. but it is always worth it. A healthy eating plan is always worth it.
Well, and the scale lies too. I mean, I've had patients who, when I had the not just the weight loss center, but regular patients for chiropractic care, they'd come in and and they'd actually gained weight, but they'd lost inches.
Yeah.
They were so fixated on the scale, they didn't realize that their body fat percentage had actually been shrinking.
You know, one of the case studies I used in our the New Normal Diet Elite program, we did that promotion we did in August, that special, was one of the case studies I had. As I had a young teenager. She was 18. No, I think she was 16 or 17.
Most teenagers are young. Yeah.
Yeah. So she was a high school student, and she had a very disproportionate body. I mean, she carried all her weight in her lower extremities, her abdomen and her hips. And we worked consistently for about 8 months, and she lost 25 pounds, but she lost 60 inches, and her whole body shape changed completely. And that's really more important than the scale.
Oh yeah, far more important. Yeah,
her whole body changed. Her whole life changed.
I mean, you can lose 3 dress sizes and be exactly the same weight.
Exactly. You can be a size. You can be 140 pounds, size 12 or size 8.
Yep.
Or size
Absolutely.
6. Yeah.
Yep.
Yeah.
So let's see. I was trying to get to our total.
So anyway, I think the closing on that is just stick with it. If you need support, find support. If you need professional support, find support. You know, it's out there, and that's really important to have the support and encouragement.
I'm just checking here. Oh, hey. I'm checking over in the group because we can't see. StreamYard doesn't pull in the comments. So in the group, we have Michelle Peel, I think. No, we don't. Not for this one. Michelle's not here. I'm looking at the wrong one. But we're doing well. People seem to be happy to come see us today. That's nice.
Yeah, we do have people, you out there, and these questions are a testament of that.
True. Hey, Beck. Oh, hang on. I was about to sneeze.
Anyway, I hope we answered your question, Peggy. And I guess we're gonna, as soon as you're finished your sneeze, we'll move on to the next one.
I've aborted the sneeze. So anyway, Becky from San Diego.
Your neck of the woods. Isn't that interesting?
Becky, actually, we do know Becky. She actually moved to North Carolina, so this must be a different Becky. Mm-hmm. She asked the question: is it better to have 3 meals or 6 small meals during the day? I'm assuming she's saying 3 big meals or 6 small meals during the day. I guess she's got the grazing idea.
Yeah, and that I get this question all the time, and that it depends on you. It depends on you and how your body functions. And my rule of thumb is always, the 3 meals a day. If you're trying to lose weight, maybe the 6 meals are not a good idea either. And it's better for your body because every time you eat, your body's going through this, massive process of digesting and breaking down that food. It's affecting your blood sugar. It's affecting, all your organ systems. And so you don't want to have that onslaught for 6 times a day. So I would recommend 3 meals a day, three good, healthy meals. And also I'd ask, why are you eating 6 meals? Are you hungry? Are you not getting the right nutrition in each of those other meals? So that would be a question.
Well, it could also be she might be reading different articles who are recommending. I just thought it was like 5 small meals during the day is what I used to hear.
Yeah, it's usually 6. But, now that, in Ayurvedic medicine, it depends on your body type. Like there are 3 doshas, Vata, Pitta, Kapha, and Vata does better with six meals. Pitta better with 3. And when a Pitta needs to eat, they need to eat. They will push people out of the way if it's time to eat. And Kapha is really maybe 2 meals a day. That's all they need.
So a Pitta Vata person would get 4 meals a day or 5?
Maybe
4.5.
A little snack, a little healthy snack might be a
little snacky. A little snacky.
Are you a Pitta Vata?
What's that?
Are you a Pitta Vata?
It's either Vata, Pitta Vata. It depends on what I wanna.
I'm a Pitta Vata.
Pitta the poor fool.
So if you, and I always bring up the doshas and the Ayurveda because I just resonate with it, and I think it's such a very profound system. And you can find out your dosha easily by going online and just Googling dosha test, and you can do your own dosha test and find out your results and see what body type you are.
Yeah, and speaking of results, I think Matt from Minneapolis is looking for some answers to what he's been doing. He says, I ate a lot of packaged foods. My employer saw one of my boxes that I prepared to microwave, and she noticed that the box listed 91%, I guess it's daily requirement of sodium, but it also had 30% of my daily protein, 91%.
91%? I've never seen that.
This is what I'm reading from Matt in Minneapolis. And he says 91% daily sodium, but it also had 30% protein. Is that good?
This is so funny. I've never seen it because the packages and labels I read are nowhere near that. I mean, the highest I think I've ever seen is 38 on maybe some packaged sausages or
maybe Matt mistyped it. Maybe it was 19% sodium.
Well, I think it's possible. I really do. Yeah. I think it's possible. So no, it does not.
91%, I would throw that thing away.
Yeah. So just because it says that it's food, it doesn't necessarily mean that it's food. It's not food. It's highly toxic, highly combustible in your system.
You nuke it in the microwave, it could go on fire.
Yeah, you keep eating like that, and you are going to end up definitely with high blood pressure for sure. Yeah, the 30% protein does not outweigh the 91% sodium at all. Sodium.
It's like he's got a box of popcorn with some bacon on it or something. I don't know.
Yeah, I don't even think bacon's that high in sodium. I don't think, but I could be wrong.
No, I think it was popcorn with bacon on it and lots of salt.
Oh, so just keep on adding. Yes, keep on adding. Yeah. No. Always, get your protein. Just get a piece of chicken or fish that you'll have a lot of protein in that meal. And I'm doing a lot of cooking these days. And
hey, how is your detox rocks diet?
It's really quite a journey. It is, you have to get into a rhythm of the cooking anyway, because your kitchen is your pharmacy for sure. You need to get into a rhythm, and your day needs to be a little more focused on you and your healthy eating and your food, and it's funny how other things sort of like don't matter anymore. And they've never were that important, but you thought they were important, but they weren't that important. So it's prioritizing and really, really making room for yourself and your health. And it permeates throughout your entire environment, everyone that you're coming in contact with. So it's like, I'm cooking. Well, I have got my aides here, and they're like, I'm teaching them as I'm cooking. I had a big pumpkin, and I cut it up and baked it I've never done that before, but my husband has done a lot of pumpkin soups. So that was so easy. And I'm going to make another pumpkin soup when we're finished this call today. So yeah, so it's really good, and I feel good, and inflammation is reducing, and some of my symptoms that I was trying to address are disappearing. So food is your medicine. Food
so you're not cranky, are
you? Maybe a little bit
hangry.
This is week 2. No, I'm not hungry at all. I'm not hungry at all. But and some of it's just a mindset. I want peace around me. I don't want the noise around me. Please give me, and of course there's noise. And so that sort of like jars the nervous system a little bit. So yeah, I've got 3 more weeks to go. So I hope to be very peaceful and placid and everything by the end of it.
and everything. Let's see.
Everything. And this is my anniversary gift to myself.
That's true. Belated happy anniversary.
Thank you.
22 years and counting.
Exactly.
Right? Did I remember that?
Exactly. 22 years. Yes.
Yeah, baby. It's in my head. Oh, the voices in my head just told me that. Hey, so Bridget from Seattle asks the following. Bridget, not Bridget Jones.
Not Bridget Jones.
I wonder if she's got a diary. Does she have a diary in Seattle? Bridget, you can let us know later. I'm planning to start a diet in a few days, but it's so close to the holidays, and I'm afraid it might be too tough to stick to. Any suggestions? That sounds like we were just talking about, but you were doing a detox diet.
Yeah, and I think we answered a similar question last week. Yeah. And this question has to be answered over and over and over again because you can do it during the holidays. Yeah. In fact, it's a great time to do it because it sort of counteracts some of the excesses and I was going to say the gargantuan delights of the season.
Gargantuan delights.
But this year it's going to be so much different anyway. So,
although 50% of Americans apparently are planning on traveling for Thanksgiving, that's a little scary.
Can they?
Yeah, that was just on the news yesterday. That 50% say that they're going to go traveling. So I think there are going to be a lot of family Thanksgivings that are going to be super spreader events. So.
Upticks, yeah.
We're staying home. So we had planned on traveling. We had planned on traveling to Mexico since my stepson's not with us this year, but now we're just staying home and hunkering down and having some Mexican turkey. So.
Well, I'm not even doing turkey because I'm on this program, and I have no idea what I'll be eating that week.
Tofurkey?
No,
you don't do
real food.
I had tofurkey one year for Thanksgiving. It was horrible.
Yeah. No, this is real food. Lots of veggies, lots of mung beans or lentils, that kind of thing. A little bit of rice and yeah.
No stovetop stuffing.
No stovetop stuffing, but I might do that for Christmas. I might.
No yams with marshmallow.
Yeah. So anyway, you always feel protected. You are in a kind of a protected shell when you're doing a program or when you've committed to a healthy eating program. So you fall off for a day or two, get right back on. Again, support is really important, and I encourage you to find it.
I think you can create your own healthy bubble, not like the
healthy bubble,
not a bubble boy, but a little health bubble that you create around yourself.
In my program, we have a private Facebook group, and it's really active. We're posting all our food, all our challenges, and it's really, really a great thing.
And it's a safe space. No one will judge you.
Nobody judges.
So speaking of judging, can you judge what this comment is from Nancy in Glendale? We got a lot of Californians here. Nancy from Glendale asks, I really want to start cooking healthier things now that I'm home a lot more. I'm a pretty good cook, but I think I'd like to introduce more plant-based meals. Do you have any suggestions?
Well, there are a lot of recipes, vegetarian recipes online that you can find, and so when you start eating these, like I used to just eat, just steamed vegetables or baked vegetables, but now I'm using a lot more spices and herbs in them, which really adds so much more excitement. Like yesterday with my pumpkin soup, it was a little bit of cinnamon, salt, and pepper, and then it was something was missing, and so I just chopped up just one clove of garlic, and and I also grated some ginger root. So these are the kinds of things you just want to experiment with a little bit. You're in a household, Christopher, of a lot of cooking going on too.
There's a lot of cooking. Yeah. In fact, it's interesting because my wife Maggie is a Mexican food blogger, and she's doing meat only like every other day or every 3 days because she's finding she feels a lot better by staying mostly with plant-based foods.
Yeah, I'm a big fan of primarily plant-based. I mean, I'm having poached eggs, which is part of a vegetarian diet anyway, but I had some fish as well on the weekend, and I could have done without it. It was kind of fine. But, when you have some of these almost meatier root vegetables, they kind of satisfy you. And also mushrooms are used a lot for meat replacement as
Yeah, like
well.
you have these portobello mushroom burgers, for example, at some restaurants.
Or even a portobello meatloaf. Portobello loaf.
I was going to say portobello and meat.
Loaf.
Hey, portobello would taste good with ground beef.
Oftentimes it's mushrooms and lentils in a loaf.
Mushroom lentil loaf.
Yeah, there's so many recipes online, and it was Bridget. Was it Bridget?
Yeah, no, this is Nancy. Oh no, Bridget was talking about she wanted to go through the holidays. Nancy was talking about more plant-based meals.
Nancy, just Google away.
Yeah, you don't have to loaf around, Nancy.
And you don't have to be perfect. Just have fun.
Have fun. Have fun with your plant-based foods.
Your kitchen is your pharmacy.
Hey, here's a place that's fun. I used to have a lot of fun here up in New York City. Mark from Brooklyn. I spent a lot of time in Brooklyn. You get the best views of Manhattan from Brooklyn. Mark from Brooklyn asks, I have a very physical and demanding job. I want to eat well, but I often end up grabbing fast food. What can I do better? I'm assuming, I'm not going to say quit your job. But with physical and demanding, I don't know if you're in construction, Mark, or if you're a first responder, or if you're doing ambulance work or things like that. I know that people who do EMT work, they often eat a lot of fast food, unfortunately, because they're running around like with some crazy schedules.
I was thinking it was a fireman for some reason.
Firemen, firemen, and also some of the EMS people.
Yeah, definitely.
Yeah. In fact, a lot of times there's snack foods in the hospitals. I've even seen ER doctors and ER nurses run downstairs, get something really super fast, and then go back to the station.
I've seen a lot of people in the healthcare world not eating very well, unfortunately, because they're just grabbing whatever just to keep them going.
Especially when they're understaffed, that happens a lot.
Yeah. So what I would suggest is pack a lunch. I mean, just
brown bag it.
Pack a lunch and bring healthy snacks with you. Nuts and seeds and fresh vegetables or cut up vegetables and cheese and just something that will satisfy you, and it'll be enough protein, fat, and carbohydrate to give you the nutrition you need, so you're not craving things and you're not running on empty.
Yeah, nuts and seeds are great. In fact, one of my favorite go-tos outside of almonds is sunflower seeds. Sunflower seeds are amazing, and they'll keep me going sometimes for 2.5 hours.
Yeah, they're
just
really
a handful. So.
Yeah, just a handful. Yeah, I just roasted some pumpkin seeds from the pumpkin, and they're just so. I put them on my pumpkin soup, and whatever pumpkin seeds, or seeds and nuts are really easy. They're easy.
Well, Mark, you could take a thermos of, say, a nice soup, like a pumpkin soup or something like that. That might actually help you too.
Yeah.
So
there's a couple of thermoses, whatever you need. You're probably expending a lot of energy and using up a lot of your calories. So
you might not be drinking enough water. I find a lot of people they don't hydrate well.
Yeah.
And that can kind of, if you don't hydrate, you'll probably, especially if you have the habit of eating fast food, you're probably going to find yourself gravitating towards, your Big Macs and your fries and other things like that.
Yeah. And it's not going to serve you. You're not going to be very healthy for long term. So yeah.
Hey, speaking of serving people, one of the things I used to enjoy with desserts. And Christine from Flagstaff, Arizona. I love Flagstaff. I really wish I could go skiing there, but I'm always there in the summertime, which is not conducive to skiing. Anyway, from Christine from Flagstaff, she said, I've always been a dessert person. What can I do to change that?
Yeah, well, it's genetics. There is a genetic marker for someone having a sweet tooth. I happen to be one of those people. But it doesn't mean you have to succumb to needing to have dessert. It's oftentimes it's habitual. It's not even something you need. So what can you have? You can have a great tea after your meal. You could have some fruit, some grapes, some nice crisp grapes, or some blueberries. That's what I had last night. Just something sweet that satisfies your sweet. So oftentimes when you are craving sweets and specifically desserts, it means that you're not maybe getting enough good, healthy carbohydrates in your diet. And so that could be added to your diet. And also maybe you're not getting the sweetness in your life as well. So maybe you are not feeling nurtured through people you know, or your work, or whatever. So you might want to look at that as being maybe one of the reasons, not necessarily, but it could be. So
I would say the contributing factor, because connection and community can actually satisfy a lot of the emotional needs that sometimes we try to soothe with foods.
And now we're missing out on a lot of that connection and that physical connection.
Yeah.
So this time now more than ever, you want to, find something that will feel nourishing and make you feel connected to not only yourself, but also your loved ones and your community.
Yeah. And I mean, those of you who are staying home for Thanksgiving, which we highly recommend, the Zoom Thanksgiving, it's not going to be forever, but it would probably be a good idea to stay safe, stay a little bit isolated during this holiday season. But I would say physically isolated, but just try to reach out to people as much as possible and stay connected, because a connection can help you fight the infection.
Yeah, and Zoom away. Yes, it does enhance your immune system for sure. Love and feeling a sense of closeness does help your immune system by far.
It was interesting. I was listening to an interview with Dr. Anthony Fauci, and he was mentioning that he did not want his kids come. He told his children not to come. They were all in
Well, you would have to say that.
Well, but he said he didn't want them to come.
Yeah.
And even though he wanted to see them, he just told them, look, he said, it's fine. This is a one-time deal. We're not going to do this every year being apart. And so I think if you understand that this is not forever, it makes it easier to adapt.
Yeah, exactly. It isn't forever. Let's just hunker down. What I am going to miss and what I love doing is going to Black Friday. I like going around on Black Friday to the malls and the stores. It's just sort of a traditional thing. And so it's just going to be online this time. And I think it started already, hasn't it?
Yeah, they've done early Black Friday, which I find is a very interesting concept. I think it started last Wednesday was Black Friday.
We could call it Gray Friday because it's pre.
My favorite, we were in Switzerland a few years ago for Thanksgiving, of all things. And my wife and I, it was 2 years ago. And so we were in Switzerland, and in all the stores, they had referred to it as Black Days. So, it wasn't Black Friday, it was Black Days.
But it's Black Days.
Black Days.
Is it like 3 days of Black Days?
No, it was just like, all the sales. They didn't even refer to it as Black Friday. They just called it Black Days, which I thought that was just very amusing. So I was taking pictures of every store window that said Black Days.
Black Days. So. Well, it's their take, right?
Yes, their take on it. But I was just so surprised to see that it had taken hold in Europe.
Yeah. Well, I think, I mean, American ways do sort of witness McDonald's throughout the entire world.
Witness. I can tell you from having gone to Hong Kong, KFC is all over Hong Kong. Yeah. At least it was.
Starbucks, everything, the American one. And I think that's why it's impacting some other countries because, Americans are like not wearing masks and rebelling. And so we're going to do that too.
Yeah, it's an unfortunate circumstance, but we all pretty much knew that once people were spending more time indoors in close quarters, there was going to be an opportunity to spread the virus more than outdoors. So,
yeah, unfortunately. So we have to stay safe and stay, let your food again be your medicine, and really, really start eating well and getting the rest you need, and the connection too. That will help your immune system tremendously.
And let your kitchen be your pharmacy.
Yes. And your food be your medicine.
and your I don't know what else to say.
And your week be dedicated.
And your week be your stronger.
And
your week be stronger.
Get strong and be safe.
Be strong, live strong, eat strong.
Yeah. Do we have any more questions?
Wear a mask. There are no more questions today. So I think
we're done for today.
Hopefully we can clock out.
We're done for the day, but we love your questions. We totally love your questions. So keep on sending them. They are amazingly wonderful. And we
And
usually
please put other questions down below, or any other topics that you may have. If you have any questions for Monika, or need an extra helping hand with coaching for your health, you can reach her on the Coaching for Health page, which is right here. We happen to stream to both Coaching for Health and Total Health Live.
We usually only have time for 7 questions, just because we like to go a little bit in depth to some extent. So we're always hoping and welcoming, and maybe you have some more Thanksgiving questions next week.
We're walrus.
Thanksgiving questions.
I am the Eggman. I am the walrus. We're walrus looking for more questions.
We're always looking for more.
No, I have not been drinking, except for water.
Yeah. So thank you for being here. Thank you,
right,
Christopher.
We will be back here on the following Friday. We're not doing Black Friday, are we?
We'll see.
We're Blackout Friday.
That's what we'll call it, Blackout Friday.
Blackout Friday, because we're not here. So we'll be back a week from today. Happy Friday the 13th to all of you. I hope it's been a lucky Friday the 13th.
Lucky. I forgot.
It was my grandmother's birthday, and she had my uncle on her birthday on a Friday the 13th.
There you go. I have some nieces that are the 13th as well. And thank you again. Applause. I have 2 nieces that are on the 13th.
Are they twins?
No, but they're not the same month, and they're not the same year.
Oh, they're not the same month.
I don't really know if they were born on a Friday. I'll have to check on those dates. I don't think so, but.
All right. Okay. So for those of you who have questions or comments, please put them down below here. Make sure that you follow Coaching for Health and Total Health Talk. So by the way, Total Health Talk is gone. Total Health Live is the group. And in fact, we have a little under 100 people in the group. We're always looking for more members in the group. And in the Total Health Live group, you'll have greater opportunity to view content as well as to ask some more questions.
And just like this detox group I'm in, it's like you can ask questions and answer your questions and support each other. That's what it's for. That's what that forum is for, to be there, to create a hub and a community, because you are our community.
So Becky, Peggy, all of you can join Total Health Live community. All right.
Yes.
Bye for now. We'll see you next week.
Bye for now.